Oncosil, a small Aussie biotech company developing a localised radiation treatment for inoperable pancreatic and liver cancer patients, has had a bit of a coup with the appointment of biotech heavyweight Dr. Chris Roberts as chairman. The ex-Cochlear chief has over 4 decades of experience in medical innovation. He's also chaired Certex, and he joins me in the studio. Chris, great to have you here.
Great to be here, Tiki.
Now, tell me a little bit about Oncosil, because it is a bit of a coup. You've been there for a year, but to have you chairing right at the time it's looking to commercialise.
Yes, well, it's really exciting to join Oncosil. It ticked all the boxes for me. First of all, it's solving a big problem in terms of pancreatic cancer. It really is a very, very nasty cancer. 5 years survival of pancreatic cancer has not improved in over the last 20 years. Median survival is about eight months. 5 years survival is like 5%. So it's a big problem we need to solve. Oncosil has some fantastic, very innovative technology to deliver radio therapy directly into the tumour. So we have
That's quite a traditional method in and of itself, isn't it? You know, going the radiotherapy on the
Yes, often
tumour
with external beams,
yeah.
putting the radiation in. But we're able to deliver about 3 times the level of radiation targeted directly in the tumour. So it's sort of a bit of a game changer about how you're delivering radiation therapy.
Yeah.
So we're doing some very, very innovative things, but importantly, Oncosil is doing it properly, doing a definitive clinical trial with the major regulators, particularly the US, so we can see definitively how this treatment fits into the management of pancreatic cancer.
So how many people have you got in this trial?
So we'll have 300 patients randomly allocated to standard therapy, either with Oncosil treatment or without Oncosil treatment. So we
and
will
this,
have
as you say, in the US, but importantly because of the FDA, presumably, and that's probably the highest bar, is it?
Yes, well, this is multi-centre, but it's also multinational. So there's certainly major centres in the US, like MD Anderson, the University of Texas, but there's also centres outside the US. So we've got centres in the UK and centres in Australia.
So you're looking, of course, for European regulatory approval as well. Correct.
So we want a CE mark from Europe. We've gone through pretty much all of the necessary steps for the CE mark. There's some final data that we want to get, 20 patients, which is the run-in part of this definitive clinical trial of 300 patients that should tick the box for the CE mark.
Yeah.
But it's not just the CE mark. We actually want to use this clinical trial to lever it to get a clinical adoption, because we want the data to be able to demonstrate how to use the therapy, where the therapy fits in and how to use it with standard chemotherapy. So
that's where you really fit in, bringing your, if you like, commercialisation expertise to the company.
Yeah, but there's some great people in the company. Daniel Kenny, who's the CEO of the company, has a very, very extensive experience in both pharma and medical technology.
Yeah.
Other board members, Roger Aston, who was the chairman, who's staying on the board while I become chairman, but he's staying there. He's a serial entrepreneur in the biotech area. Yeah.
How, just more broadly, I mean, you used to chair Certex, which was also a similar company in terms of concentrating on the liver as well, I think. But that had a bit of a swoon or a drop in its share price when one of its programs was not actually failed to hit its main target this year. From an investor's point of view, they're very difficult companies to invest in, aren't they?
But if you take Certex, if you take the long picture of Certex, that's been a wonderful ride. Certex is making a significant contribution to a large number of patients. It's one of the world's leading interventional oncology companies with a very, very important treatment for liver cancer, which is also a difficult cancer.
So you think it's got a long future?
I think it has a very, very long future, and as you do more clinical trials, you start to tease out how best to use it.
Does it compete with Oncosil?
No.
Even though they're both sort of intervention?
Not really. So both are delivering radiation, but Certex does it through embolization, and that's ideal for the liver. Oncosil is doing it through placement of the radioactive material through an endoscope into a solid tumour, and that's ideal for something like the pancreas. So at one level, they're actually very complementary, but they're not competitive.
Chris, do we have a growing and a good, what do you call it, environment now for medical technology, do you think, in Australia?
I think we do if we can think globally. It's about how do you develop these technologies that can be globally competitive and build some ongoing commitment to research and development and clinical work to make sure the innovation stays.
And then get the patents there if we can keep them.
and get the patents. But it's not only about that, it's about the know-how and the clinical trials. And I can't emphasise enough the importance of doing it properly. It's not just a case of getting some regulatory approval and see how much you can sell. It's really about getting the regulatory approvals, but working in conjunction not only with the regulators, but with the key clinicians around the world, the key medical oncologists and the like, to understand where the fits in to their armamentarium.
And what about our students in our universities now? How are they looking at, you know, our researchers in the universities? Do they see things differently these days?
I think the students, I think the big change in the university students is the increasing interest in entrepreneurship and how many students actually want to set up their own company coming out of university. So it's a wonderful environment in Australia for startups. And that's what we need to do in Australia.
So solve the disease, but make money while you're doing it, or whatever.
Absolutely. Well, many of these things, you're not going to do it if there's without a commercial intent. You're not going to be able to track the money and the like. So it's
the other thing you're involved with is this Plus Alliance thing. Now, tell us a little bit about that and about setting up this this big engineering school potentially in London.
Yeah, so after I stepped down from Cochlear, I put a portfolio career together, which includes some government board activities and some other boards like Oncosil, and I'm still on the board of ResMed, but I've also taken a part-time professorship with an alliance of 3 universities. So University of New South Wales, King's College in London and Arizona State University, which would be the largest private research university now in the US, 100,000 students.
In Phoenix, Arizona?
They have 5 campuses in Phoenix, Arizona. About 75,000 students on campus, about 25,000 fully online students. So they're one of the leaders in the world of online.
So what are you looking to do?
So what we're doing is looking at building what would be a transformative engineering school in London with the 3 universities involved.
Chemical engineering or...?
It would probably be a general engineering with some specialist areas where if you wanted to do chemical, you probably wouldn't do it in London. You might go and spend some time, for example, on the campus here at UNSW. So the idea, maybe you do some online, maybe you do some on different campuses. And engineering is going through major transformation about how you should teach engineering. And it hasn't, in many engineering schools, it's not really changed in 50 years, but it needs to change, and it needs to change to be able to attract more women into engineering. If the future is technology...
Briefly, global is the key there, from what you're saying.
It is absolutely global, but we set something up like that, we want 50% female students in there. So it needs to be engineering connected to humanitarian needs of what you're trying to do.
Yes, Chris Roberts, thank you very much for joining us. Fascinating.
Thank you, Tikki.